Valleywise Health recently reopened 15 psychiatric hospital beds at its Maryvale location, beds that had been shuttered since 2022 due to staffing shortages. Today, dozens of beds remain unused, but Valleywise plans to gradually reopen them. Joining us today to discuss this more is Gene Cavallo. He's Senior Vice President of Behavioral Health for Maricopa Integrated Health System, Valleywise, as we call it. Thanks for coming in.
Thank you for having me.
So it's a big deal to have these 15 beds because they're very important. Talk about first who these beds are for.
Well, very good question. We do the court-ordered mental health evaluations in Maricopa County at our 3 behavioral health centers, Mesa, Maryvale, and on the main Roosevelt campus. So these are for individuals who someone in their lives, family members, law enforcement, possibly outpatient providers, believe that they need mental health treatment and they're unwilling or unable to get it voluntarily, and so the law in Arizona allows for an involuntary process. And so we do all of the involuntary evaluations at our facilities.
So these beds closed a couple of years ago due to staffing shortages. You still also have other beds at the Maryvale location that need to be reopened. What did you do in order to, I guess, get people? I mean, these are tough jobs.
They're tough jobs, and there's a lot of competition, especially for the behavioral health technician role, because it's a kind of an entry-level job, and there's a lot of jobs in our labor force that are in that same pay grade. And so we did have to raise our pay grade somewhat. We got some money through the American Rescue Plan Act from COVID, through Maricopa County as well as the governor's office, to allow us to do some what we called a SOAR program, sign-on and retention bonuses. So that really, I think, jump-started this for both our RN jobs and our BHT jobs.
Yes, the retention is just as important as the sign-on, and some places don't get that. So the sign-on and the retention bonuses, is that something that you're going to continue? Because you still have, I think we did the math, and it was 54 beds that are still available at the Maryvale location.
It was meant to be, I believe, an approximate 3-year program, so that we have sign-on as well as retention. And so we're going to continue to pay those retention bonuses to staff members who meet the criteria, in terms of how many hours they worked in a given year.
What does the process look like in order to hire so that you're able to open those remaining 54 beds?
It looks good. If you asked me a year ago, we did not have this much optimism. So we're targeting September as opening some additional beds at Maryvale, and then that may leave us a year from now. We'd hopefully be done, and all of them would be open.
Why do you say you weren't optimistic if I'd asked a year ago? Did you not have the money then, or?
We had the money, but it still wasn't happening. We weren't getting enough people in to offset the people that were leaving. So the last, 6 months or so, we've really had a much better percentage of staying than we had back then.
Let's talk a little bit about your partnership with Creighton University. How is that helpful?
Well, it's extremely helpful because we get nursing students, we get medical students that do their rotations in our facilities, and so some of those nursing students come to work for us as nurses. We get several of our psychiatric residents through the Creighton Medical School, so it's just a win-win for everybody involved.
Valleywise has a new flagship hospital that will be opening very soon, and this is news, I think, that's important to taxpayers because it relates back to something that taxpayers approved back in 2014, right?
Correct. The Prop 480 was a proposition that passed in the November 2014 election that the voters of Maricopa County overwhelmingly said yes to allow Valleywise Health, known as MIHS at the time, to do several things. Build a brand new medical center, which now is going to open next month, to expand behavioral health, which we bought the Maryvale Hospital in 2018 and opened it in 19, and to expand our burn care as well as our residency programs to train physicians of the future. So we really have done all of those things and many more.
So the behavioral health aspect, obviously the Maryvale location, you've got 54 beds total there, correct?
We have 192 total at Maryvale.
Okay.
We got 54 left to open.
Gotcha. 54 left to open, and then throughout the system, because you've got one location in Mesa, one sort of central Phoenix, and then one West Phoenix in Maryvale.
Correct. So that's 412 total.
And talk about the people who do these jobs, because as I said, it's a tough gig. I mean, why do they come on?
Well, I meet with all the new ones, the new employees in their first week, and I just met with some last week, and I kind of ask them, can everybody do this job? And they all overwhelmingly say no. And I said, it's not about the pay, I'm guessing. So what is it? And somebody once told me, one of our new hires said it was inner rewardedness, meaning that feeling that you get when you're doing something special and making a difference in people's lives. That's what makes people do this work, and that's the kind of people that we want to hire.
Well, we definitely need them. So thank you for sharing that, and thanks for coming in. Gene Cavallo is Senior VP Behavioral Health at Valleywise. Thanks for your time.
Thank you.